Welcome everyone to Mayo Clinic Q&A. I'm Dr. Helena Gazelka. Well, great progress has been made in finding ways to prevent and treat cancer. It still remains a significant risk for Americans during their lifetime. The National Cancer Institute estimates that 40% of Americans will develop cancer during their lifetime. The most common types of cancer in men are prostate, lung, and colorectal cancers, while in women, they are breast, lung, and colorectal cancers. Now, there is no sure way to prevent development of cancer, but experts agree that your lifestyle choices can affect your risk. February is National Cancer Prevention Month, so what a great time for us to be discussing this. With us today is Dr. Paul Limburg. Dr. Limburg is a gastroenterologist at Mayo Clinic. He's also a researcher with Mayo Clinic Cancer Center's Population Science Program. Thanks for being here today, Paul.
My pleasure. Thanks for your interest in cancer prevention.
Yes, what a great topic for us to bring up, particularly in light of February being Cancer Prevention Month. So thank you. Paul, I'm wondering if first off you could tell us what the Population Science Program at Mayo Clinic is.
Sure. So Mayo Clinic's Cancer Center has multiple programs that focus on basic science, trying to find new ways to attack cancer, if you will, based on laboratory discovery. Then there are clinical programs where we bring those learnings from the lab into clinical practice so that we can work directly with patients. The Population Sciences program really deals with larger groups. So trying to look at ways to prevent cancer or control cancer, sometimes monitoring patients after they've had a cancer diagnosis in larger settings so that we can look at risk factors or new ways to intervene, new screening methods, all of those based on molecular science so that we can tailor our approach based on what we learn from larger populations, and then again, bring it back to the clinic or the lab to continue making advances.
That's fantastic. It sounds like a great approach to do the research right where you're treating the patients as well. What a great continuity.
Absolutely, and it all centers around what is best for patients. How can we make sure that the patients are at the center of everything that we do? Cancer in many ways is, as you mentioned, a devastating disease, but if we can start to understand better about the biology and who's affected and how they're affected and how we can modify risk, then I think we can continue to make headway and hopefully reduce the overall burden and suffering from this all too common disease.
Paul, speaking of making headway, I mentioned in the intro that there are risk factors for cancer and some of them are modifiable. Can you tell us what some of the risk factors for cancer are? And I would imagine that it varies by the type of cancer that we're discussing.
It does to some degree, and there are some things that are common that we can do to try to reduce the risk for multiple cancers and other health conditions. So the three ways that I would think, or the three areas that I would think about assessing risk and hopefully reducing risk would be know your personal medical history, know your family history, and then pay attention to what you're exposed to. So things in the environment. So let's start with personal history. That might be one where there's more specificity to some of the different personal medical conditions and their link to various organ defined cancers. So for example, as a gastroenterologist, I think about conditions like inflammatory bowel disease. Something that affects the GI tract can sometimes lead to precancerous and then cancerous conditions in the GI tract. So know your personal medical history. Family history is really a way for us to try to get at the genetic contribution to different types of cancers. There are some families where cancers can be seen across generations. So, grandparents and then parents and then siblings and maybe even children all diagnosed with some type of cancer, sometimes even the same types of cancers. Those should be indicators to have a discussion with your clinician to see, is there anything about my family that might signal a genetic predisposition to cancer? And then lastly, probably the biggest area that we still need to make more headway is exposures or the environment. So some common things, eating a healthy diet. We all know that there are some good things and some bad things about our diet. Eating, too many refined or processed foods is usually not good for our overall health if that's our daily pattern. So sticking to natural products, having a healthy balance of plants and vegetables. If you are somebody who likes to eat meat, make sure that the cooking preparation is safe. So having a heavily charged surface to the meat has been linked to some types of cancers, for example. So diet is important. Exercise is important. Getting regular exercise, at least 3, maybe even up to 5 days per week is helpful to reduce cancer risk, also to reduce risk for things like heart disease and other chronic conditions. Hydration, as simple as it sounds, making sure that you are well hydrated. There are data and there's information on quality sites like mayoclinic.org that talk about what the right amount of liquid should be in a daily diet. 8 glasses of water a day is an easy number to remember, and that has been shown to be associated with, again, protection or reduced risk for some harmful conditions. Last 2, alcohol and tobacco. Alcohol in moderation, tobacco, I think none at all. All of those things are within our control to try to make sure that we are living a healthy lifestyle and therefore reducing cancer risk.
I think this is a great time to be contemplating this too, because at the beginning of the year, so many people set goals for where they would like to go during the year. And so what great goals to set, but to live a little bit healthier and decrease your risk of cancer this year. I think with COVID-19, a lot of people got out of some of their good habits perhaps. So what a great time to start up again. I have to say, Paul, that I learned something. I didn't know that drinking water or hydrating was important in decreasing risk of cancer. That's really interesting.
And I think in some ways it's maintaining that overall balance. There are some, studies that have looked at weight or energy intake, and really, in some ways, it gets back to that homeostasis. We really do need to make sure that we're doing the right things and keeping ourselves within that range of, how our body works best. And if we can do that, and if we can do it in a sustainable way, everybody has probably gone on a diet and quickly fallen off of a diet. So I think as we start to think about this, as we start to say, what can I do in 2021 that's different and maybe improve my overall health, do something that is a small step forward and that you can continue, so that when you take that next small step forward, you're starting from a different, hopefully better place.
I like that. I've heard so many people saying this year that a balanced lifestyle. So a little better eating and a little more moving rather than starting these big diets for the new year is a better approach.
It is. And I think there's also another category where our research program has paid some time and attention over the last 2+ decades, and that's called chemo prevention. So there are multiple studies that have looked at, could the medications that we take or the supplements that are available, could that modify our cancer risk? And it goes back to the biologic development of cancers, precancers. Inflammation, for example, seems to be an important contributor to development of cancer. And there are some relatively common medicines like aspirin, anti-inflammatory medicines that may give benefits with respect to sort of acute symptoms like pain or headache or something like that. But over time, if it's safe to take an anti-inflammatory medication, there's also some fairly compelling data that medications or chemo prevention might reduce cancer risk as well.
Well, that's really interesting. And that's a great thing for our listeners to discuss with their physician and see whether they'd be a candidate for that kind of therapy.
And always to remember that medications, like everything else, have benefits and also some potential risks. So don't start on any new medicines. Don't even start on any new supplements without talking to your healthcare provider.
Sage advice. Paul, what does it mean to be at high risk of cancer?
Yeah, it's a great question. So when we talk about risk, we try to grade along a continuum. I personally would talk more about average risk and increased risk. There are technically some groups that are high risk, but I think in some ways that maybe gives the wrong impression. So let me explain a little bit. Heritable syndromes or family history of cancer, that might be a group of patients who have high risk or are at increased risk. But just knowing that about your family can lead to an important conversation and a plan with a healthcare provider to say, here's how often you need to do screening evaluations. Here's some other things you can do to try to reduce your risk, to bring it back closer to that average risk level. So I think that if we tell patients they're at high risk for something, we don't want to give the impression that, oh my gosh, you know, there's no way that I can avoid this. I just better be prepared for when the cancer comes. There's always something that we can do. And so I like to think of it as average risk or increased risk, and then try to, you know, move the level down closer to the low risk categories as we can.
Paul, if an individual does not know their family history, or if it's one of those families where you don't discuss those things too much, and you know that somebody might have died from cancer at some point, but not whether it's a heritable, is there a way that that can be determined?
There is to some extent. So most cancers are age related. So as we grow older, our chances of getting a precancerous or a cancerous condition go up. So in some ways, that's a good general indicator that everybody can pay attention to. And there are age-related prevention guidelines mainly centered around screening. There are at least 4 cancers for which screening has been shown to be effective and is recommended. So breast cancer for women, cervical cancer for women, colon cancer or colorectal cancer for both genders, and then lung cancer in a subset of patients, particularly those who have been chronic smokers. There would all be tests could be used for screening in those settings. When we talk about prostate cancer and skin cancer, there are ways to screen for those conditions as well. But those conversations are more based on discussion with a patient and their provider to find the right approach. Back to the family history question, there are some genetic tests that are now available. I'm sure we've all heard about, you know, the gene panels and how you can send a blood sample or a swab of your cheek in to get a gene panel conducted. There's some information there, and a lot of it gets to some of the genetic syndromes that predispose to cancers and precancers, but it's powerful information and it's a lot of information. And I would encourage anybody that is interested in doing a gene test, whether they know their family history or not, to again have that detailed discussion with somebody whose medical advice you trust, and then decide whether or not that's the right approach for you.
And Paul, I would imagine that patients or individuals could get a false sense of security from having a gene test if they relied too heavily on that information, and that the continued screening and regular exams with a healthcare provider are very important.
That's right. We always have to, you know, use the filter of no test is perfect. Now, the gene tests are really good, and the technology has come a long ways. And actually, the cost has diminished or decreased dramatically since the time that some of these initial genes were discovered and linked to different conditions like cancer. So absolutely, don't rely only on a test result, but make sure that you put that in context. And again, back to where we were before, a healthy lifestyle is good for you in many ways beyond just reducing your risk for cancer.
Also reduces your significant risk for cardiac disease too, which is another major issue for Americans. So sage advice goes a long way. Are there any specific medical treatments that can help to prevent cancer, Paul?
I think the chemo prevention area, so medications, and right now anyway, there are not definitive guidelines on what medicines to take strictly for the purpose of preventing cancer. There are some recommendations from groups like the United States Preventive Services Task Force around aspirin. And if you meet criteria to take aspirin to reduce your risk for heart disease, for example, you may also get added benefit to reduce your risk for something like colorectal cancer from taking an aspirin maybe once a day. So again, talk to your providers. They are up to date with those chemo prevention guidelines. I think that taking supplements based on what a bottle label would say, or what you might read on a product, a company's website, I'd be a little bit more cautious with that. And again, trying to make sure that there is enough evidence to support something in that chemo prevention space. Beyond that, really the best we can do as healthcare professionals and as patients is to focus on early detection or screening.
Paul, I think that a lot of our listeners would be interested in the work that you do and other researchers do at Mayo. I'm wondering if you could share with us any innovations that Mayo has made regarding cancer prevention or even ongoing research.
Yeah, I think bringing the molecular component into the prevention conversation has been a major step forward. We're starting to understand the process of carcinogenesis. Carcinogenesis is really what happens when a cell goes from initially normal all the way to becoming an invasive tumor. So somewhere along that pathway, hopefully as early as possible, we're trying to intervene, we're trying to find ways to interrupt that carcinogenesis process. So there are ways that we can do that. With screening, we can find those precancerous stages of carcinogenesis. And if we find a colon polyp, for example, we can take those colon polyps out and prevent cancer. If we find some of these more biologic or cellular-based targets like mutated DNA or methylated DNA, then we can actually, at least in the future, we could target those specific pathways in the carcinogenesis process. And there's teams of scientists in the population sciences program and also elsewhere in the Cancer Center that are really working to figure out what are those targets, what are those pathways, and how can we do something to interrupt what would otherwise lead to an invasive tumor.
Paul, a lot of what you're describing is what we would call lab research or bench research. Are there any ongoing clinical trials at Mayo Clinic regarding the prevention of cancer?
There are. So we've been funded, fortunately, by the National Cancer Institute in my program to do chemo prevention studies over the last 2 decades. And we've established an international consortium. We've got about 30 partner sites where we organize trials with generally healthy people to look at some of these medications and supplements to see if they can show a sign anyway of reducing cancer risk. So that's one big area of clinical studies. Also in the screening space, Mayo Clinic is actively involved in developing new screening technologies, testing those new biomarkers, if you will, signals to identify whether or not early cancer is present. And one area that's been particularly interesting and I think is actually on the foreseeable horizon is, could we use a blood test or a liquid biopsy to screen for multiple cancers? So instead of one test and a different test to screen for breast cancer or cervical cancer or colorectal cancer, having a single blood test and trying to understand, is there something that we can identify in that sample that tells us whether or not there may be cancer anywhere in the body, and then to do follow-up testing to try to pinpoint the location of where that abnormal signal was coming from.
That would be amazing, Paul, if you could do one blood test and find out so much information.
Yeah, and again, you know, what we're trying to do is make sure that the technology doesn't outpace the application. So because the basic scientists are so good and they're, you know, learning so much about all of these different markers and pathways associated with tumor development, we want to make sure that when they get to the point of saying, here's a panel of markers that we can measure from a blood test, that we're ready as clinicians and we're ready as guideline groups, and the FDA is ready, and other groups that have a role in making sure that a test is available to patients. We want to make sure that all of that is ready when the laboratory data suggests that it would be a good time to actually start to apply a multi-cancer screening test.
I can imagine that about now, Paul, we have some listeners who are thinking, I wonder if there's a way that I could participate and contribute. Is there a way that our listeners can find out about ongoing clinical trials that they may qualify for?
Yeah, so the Cancer Center webpage is a good place to go, or, you know, contacting Mayo Clinic more generally and just asking to be referred to the Cancer Center research program. I think that's the best way to do it. Now, for specific studies, we always have a plan in place to try to identify patients who might have conditions that would make them eligible for a study. So there are advertisements that come across in different ways. Check the Mayo Clinic websites, check the Mayo Clinic Facebook page to get linked to appropriate information. And then, old school, like newspaper, radio, listen for anything that might be of interest. But, contact Mayo Clinic through whatever mechanism you have, explain your question and your interest, and, the resources available will put you in touch with the study teams.
One of the big concerns that we've had at Mayo is that we want to provide not only good, solid medicine, evidence-based medicine, but also prevent disparities in medicine. And Paul, I'm wondering if there are disparities that you are aware of related to cancer prevention and what work might be going on to help to resolve those.
Such an important question. So there are absolutely established disparities in cancer outcomes across different populations and population groups. It's multifactorial, as you might guess. So there is likely some access to healthcare, some socioeconomic overlay, some awareness. Sometimes the messaging comes across, and we, groups will use a one-size-fits-all approach, but the messaging or even the channel that it's delivered doesn't work for a given population. So some populations tend to get their information from radio. Some tend to get their information from social media. So we have to do a better job of understanding how we can meet people where they are. So for any groups where, based on whatever the factor or factors are, if they have been shown to have different worse outcomes from cancer, the most important first step to me is finding how to connect with that community, having thought leaders from that community get together and really have what are called listening sessions. So what can we do? How can we do a better job to improve screening participation, or to talk about the tests in a different way so that they're more acceptable to a population? How can we break down barriers, whether they're insurance barriers or awareness barriers or whatever they might be, so that we can really all work together to make sure that people have access to early detection, to other prevention technologies, and to treatment and follow-up, because that's what's really going to make a difference if we can combine all of that, but do it in a targeted way so that it makes sense to the groups involved.
What important work. Thank you for sharing with us today, Paul.
Absolutely.
Well, February is National Cancer Prevention Month. And here discussing this with us today is Dr. Paul Limburg, talking to us about cancer prevention. Dr. Limburg is gastroenterologist and a researcher with Mayo Clinic Cancer Center's Population Science Program, and we are so grateful to him for being with us today. I hope you learned something. I know that I did. We wish everyone a wonderful day.
Mayo Clinic Q&A is a production of the Mayo Clinic News Network and is available wherever you get and subscribe to your favorite podcasts. To see a list of all Mayo Clinic podcasts, visit newsnetwork.mayoclinic.org. Then click on Podcasts. Thanks for listening, and be well. We hope you'll offer a review of this and other episodes when the option is available. Comments and questions can also be sent to Mayo Clinic News Network at mayo.edu.